Good evening, everyone. Thank you for joining us on this, our fifth webinar from the OSA Membership Services team. This webinar will focus on concussions, and we're extremely proud to work with the experts at Holland Bloorview Kids Rehab in downtown Toronto when it comes to cutting-edge research in this area. Our presenter this evening, Dr. Nick Reed, led a workshop at the OSA conference in March and recently concluded the first symposium on concussions in youth held at Holland Bloorview Kids Rehab. And with international collaboration, a single vision is being created to better understand and treat concussions in youth. Please sit back and enjoy the next 45 minutes. If you have questions, please direct them to me in the chat room, and I will raise them at the end of Dr. Reed's presentation. I'll now hand over to Dr. Nick Reed, who will take you through the next 45 minutes.
So thank you so much for having me here today. Again, I hope everyone can hear me. Matt, if you can let me know if that's all working.
Will do. This looks good. Sounds good, Nick.
Okay, wonderful. Thanks. So thank you for that lovely introduction. I really appreciate it. I wanted to pass my thanks on to Matt and to Sharon and just to the Ontario Soccer Association in general for all of their work and efforts around kids' concussion. Kudos to you guys for putting this at the forefront within your organization, and I'm always happy to share whatever I can with your group, and hopefully we start to spread some knowledge across your association and even broader. So tonight what I'm going to do is spend the next 50 minutes or so, hopefully we have time for some questions, just giving you a sense of concussion in general, but also specific to soccer, and even more specific to the role of the coach. So I'm repurposing the majority of this presentation is what we showed at the OSA Coaches Conference a while back that Matt kindly invited us to talk at. And I think a lot of this information, although some of it may seem fairly simple, that's the whole point. We're working with kids. We want to make sure the messaging is succinct and easy to digest, and that's exactly what we're trying to do. So I hope you enjoy it, and there'll be lots of contact information at the end where you can reach out to me and we can keep the conversation going after tonight. So let me advance here. Just bear with me, it doesn't seem to advance. There we go. Okay, so as far as an agenda, I'm going to get into a quick introduction of myself, get into a bit of the Concussion 101. What are the basics? What are the things we all need to know about concussion? I always like to talk specifically about concussion in kids and why we even care about this injury in children and what makes that kid so different from the adult or from the college-aged athlete. Then really talking about quick stats around concussion in sport and a few studies that have been put out in the last couple of years around soccer specifically, so concussion rates and some of the mechanisms for injury in the sport of soccer. I want to touch on some ideas around concussion management, so some of the strategies and self-management techniques that we use clinically at our facility and I know are used more broadly across other facilities in the country and the world. I'm going to touch on this idea of baseline testing. I know it's a little bit different when I don't see all of you face-to-face and we can't sort of have this a bit more interactive, but I know this is usually something that people want to hear more about, so I thought I'd throw it in there and just at least touch on it, and you can always reach out to me at a later date to discuss further. And also this idea of the role of the coach. So what is that coach really responsible for when it comes to concussion? So what I hope you get out of this session is a better understanding of concussion and concussion specific to your sport, soccer. Again, these approaches to managing the injury, what the role of the coach in concussion management may be, and hopefully a whole lot of resources, links, ideas, websites that you can check out that in my opinion are quite good and could hopefully impact your practice, what you do with your athletes in your personal life, just so that you build your toolbox and can have as much great knowledge as possible. And also, I'm going to put it out there right now. I'm a contact for all of you if you need it. So if anything ever comes up or you want to get more involved in this field, or even from a research perspective, you reach out to me. I'd love to engage you in all the things that we're trying to do from a concussion perspective. And not just at Holland, Bloorview, and Toronto, but we have a great network across the province. Some really great folks at different sites that we can always link you up with locally to your site. So who am I, really quickly? So I'm not a soccer player by background, but I have shared your fields quite often as a lacrosse player. So born and raised in the beaches in Toronto playing lacrosse. I studied my undergraduate work in kinesiology at McMaster University, where I also played a little bit more lacrosse. Then I came back home to Toronto to study occupational therapy and played a bit more lacrosse. And then I punished myself a little bit more with a PhD in rehabilitation science specific to pediatric concussion. From there, I opened a private practice as a means to provide services to kids and adults specific to concussion, really just to meet the need in the community that wasn't there. And from there, transitioned to Holland Bloorview Kids Rehabilitation Hospital, and I'm also an assistant professor in the Occupational Science and Occupational Therapy Department within the Faculty of Medicine at the University of Toronto. So within these roles, primarily at Holland Bloorview, I'm looking at, we're creating a kids concussion research program, as well as a clinical service, and growing our program every day. It's quite impressive, the support that we're getting from around the province, and can't wait to share as many services as possible with all of you if needed. So what is a concussion? What are we even talking about here? So pretty complex definition up there, but basically what's going on when you have a concussion is you have two hemispheres of your brain that are sitting inside what I like to call a jello mold. So they sit inside that jello mold, and that jello mold is designed to protect that brain from moving around too much, absorbing some of that force that it might take on with a given impact, and keep it from smashing up against the inside of the skull, which is an extremely hard part of our body. So the main mechanism, or one mechanism of concussion, is this idea of that the body or the head getting hit hard enough where there's enough force for that brain to move around inside that skull, and the jello mold just isn't going to cut it, and that brain hits up against the skull. And what's going on there is there's a more localized injury. So whatever area of the brain that's sort of impacted with that contact by the skull is going to be affected, and the functions that area of the brain is responsible for, you're going to see some deficits in that area. So that's one mechanism. The other, which is a bit more of a more complicated injury, is what we call rotational acceleration. So if y'all remember that Sidney Crosby hit that we all saw far too many times on the news over and over again, where he spun around on what looked like a corkscrew, and his head really twisted around in a rotational fashion. So what's going on there is our two hemispheres of the brain, the right and left, that are connected with a whole bunch of blood vessels, connective tissue, they're shearing against each other. So when they shear against each other, they're pulling apart, they're twisting against each other, and we're seeing a lot of damage within those connective tissues between the two hemispheres. And when that's happening, we get what we call a diffuse injury. So instead of just one local area of the brain being affected, we're seeing lots of different areas of the brain being affected. And oftentimes that's when we have longer recovery times, and also a broader range of symptoms, because there's more areas of the brain that are going to be affected. So with all that said, sort of a complicated explanation, I like to make it really simple, especially for kids and families and coaches and schools. I call it the invisible injury. And the reason I do that is, if we have these two kids show up at our practice, or maybe our classroom if you are a teacher, and they have an arm in a sling, or their ankle looks all bruised up and ugly, we're probably going to give these guys the benefit of the doubt and some leniency. And maybe they don't have to run the 20 laps with the team that day, and maybe they don't have to write that math test that day. And we're going to give them an opportunity to recover. But when this young man shows up at practice or at school, it's really difficult to see what's going on inside his brain. So this young guy's had a concussion, but he looks pretty normal, right? And unless he has those skills to really recognize his symptoms, and how his body feels, and unless he's confident enough and supported enough to really voice how he's feeling. And also another variable there is, even if he's confident enough and able to voice how he's feeling, whoever he's voicing it to still has to be receptive to whatever he's saying. So this young guy has a little bit of a harder time, and it's more difficult for us to support him. So when it comes the signs and symptoms. This is just a little infographic that we put together. Again, this idea of making information a little more digestible, not pages and pages of literature for families, but really keep messages simple. So you'll see from this list of symptoms, signs of concussion and symptoms, it's quite broad and not very specific. So a lot of these things are symptoms that we feel on a regular basis. Probably after you listen to me talking tonight, you might feel a little bit more fatigue, maybe a headache. Hopefully not too much, but you never know. And these range from physical symptoms, the typical ones you might think of a concussion, sort of headache, nausea, some dizziness. We also have some cognitive or mental deficits that can happen where you're sort of slow thinking or difficulty concentrating or memory issues. The emotional and behavior side is a big one. And I know, myself, I coach youth lacrosse, and sometimes it's hard to know if someone's just irritable all the time or not, or these teenagers are not the easiest group to work with, but we really need to keep an eye out and see, are these kids behaving differently than they normally would? Are they more irritable than normal, more sad, more frustrated? And then finally, this idea of sleep. This is a really big factor that can be impacted by concussion, where you may be sleeping more than usual, or you may have real trouble sleeping or staying asleep. And we need to be aware of all of these signs and symptoms. So the key here is oftentimes, this injury can be fairly short-term. If we manage it properly with some good rest, some good information, some good care, and some good support from coaches and teachers and parents and everyone in that child's life, we're hoping this injury can be quite short-term for about 70 to 80% of the population. And we're doing more research to really flush that number out. Well, most of this research to date on statistics like that have been done in college-age athletes. So we really want to make sure that we're putting the right numbers to the kid population. But we do have that other percentage of the group that's going to have long-term issues. So when I say long-term, it's symptoms that progress past 4 weeks. And in my clinical practice at Holland Bloorview, we see kids exclusively that have persisting symptoms. So these are kids that could be 4 weeks post-injury still dealing with issues. It could be 6 months. It could be a year. It could be 2 years. So this injury, if not managed properly, it can be a big impact on kids' lives. Regardless of short or long term, the key here is that these symptoms are all going to have functional implications. So a headache just isn't a headache. That headache's going to make that child not be able to write his math test or to socialize with his friends or take the pitch with his team. So we need to really get outside of just thinking of symptoms as this medical problem, but really relate them to these child's lives and make sure that we're supporting them as best we can. So some take-home points around the signs and symptoms. One, we know every injury is different. So this can be even within individuals, across individuals. As you saw, there's a lot of symptoms there that we're looking at when it comes to concussion. So you can experience a range of them, and sometimes you'll have different ones than other times. So the reason I say that is we need to be cognizant of, if one of our athletes or our children or for anyone that's involved in your lives that you're working with has a concussion, and they told you they have a certain amount of symptoms, whether it's headache, dizziness, and then someone else just reports maybe some anxiety or maybe some sleep issues or some nausea and doesn't have those same symptoms, it doesn't mean a concussion hasn't occurred, and we have to be really cognizant of that. We also know symptoms may not appear right away, and I often liken this to if you're playing some pickup soccer and you tweak your ankle a little bit, you tighten your boot up and you keep on going. And it's a little uncomfortable, but you make it through that match, and then you go home and you're okay. But when you wake up the next morning and you get in the shower, that's when you realize that ankle's pretty swollen and feeling pretty run down and really sore. And it's the same thing with the brain. The physiological processes are exactly the same, and we need to make sure that, especially in tournament play, in situations where that child may seem okay, we need to keep monitoring them and make sure the next day we keep asking them if they're doing okay. We know that signs and symptoms may be missed early on by lots of people, so it really is a team effort here. And again, I commend the Ontario Soccer Association and Matt and his team for really promoting this within your organization, because it truly is key that we all have the same information so that we can all recognize this injury and help out whenever these things may be missed by others. And this is a big one, and I'll tell you, the kids that I coach really don't love me for this one, but I think it's, especially with kids, we need to be very conservative. So even if there's only one symptom reported, maybe a bit of a headache or, feeling really tired after a significant impact, we need to treat it as a concussion, and we need to make sure that child gets some care, and we manage it with some of the strategies that I'm going to talk to in a few slides here. Because we don't want to take that risk of putting a young athlete back into play if they've sustained an injury to the brain. And if we do that and they have a second injury before that first one is healed, that's where we have a situation called second impact syndrome, where things can get really difficult and could even be fatal, and we want to avoid that at all costs. So a few more things. Again, another infographic just to sort of make this information a bit more digestible. And I will say, if anyone's interested in sort of accessing these for their clubs or even in their personal networks, just let me know. Send me a note. Again, my contact information will be at the end, and I'd love to get you as many materials as we can. So 6 things you need to know about concussion. It's a brain injury, right? A child's brain is still developing. You can have a concussion without losing consciousness. And that's a big one. People think you need the knockout blow to diagnose a concussion, but that's not at all the case. We know that symptoms aren't just physical. As I mentioned, there can be mental, emotional, behavioral symptoms. And I think this idea of it's essential for recovery to rest your body and also your mind, and I think that sometimes that's overlooked. And I'll touch on that a little bit more as we move along. Okay, so concussion in kids. Why are we even thinking about kids? So I think it's really important for us all to realize that kids are not mini adults. They're different. When it comes to their physiology, their emotions, what's going on in their lives, the demands, the activities they do, their goals, the supports in their lives, the different people engaged in their lives, and the environments they're doing things in. They're all very different than adults, and we need to have a specific focus when it comes to the management and treatment of concussion, and also what we do from a research perspective. So when it comes to physiology, and I won't take too much time here because I want to make sure we do have an opportunity for some discussion, but when it comes to physiology, we know that kids' brains are more vulnerable to sustaining an injury. So we know that brain inside their skull is lighter, and with a lighter brain, it's going to require less force to be moved around in a significant way. We also know, and I look at my kids, my daughter's 3 and my son is 1, and they got some pretty big heads on some pretty small necks, so they lack the musculature to control that head acceleration. So we want to make sure, if you imagine a neck sort of, or the head moving around and that neck not being able to sort of activate muscles and absorb forces, the chances of that brain moving around are much higher. We also know that the coating of the nerve fibers in the brain for kids it's decreased. They're still developing. So when we're talking about that shearing type of injury, it's much easier to tear the nerve fibers and to stretch them and cause that diffuse injury. And we also know the brain in kids, their skulls are softer. So there's the decreased protective properties and more so related to more severe brain injuries, but we need to be aware of that. We also know that kids are more vulnerable to prolonged recovery and persistent symptoms. And we know that idea of this diffuse injury, which I mentioned, sort of that widespread injury throughout the brain, kids are more susceptible to this, and we need to make sure that we recognize that and realize that because of that fact, recovery times may be much longer for these kids. We also know that kids have critical periods of development, and if there's an injury that takes place in those critical periods, it could impact how that brain functions for years to come, and we need to be really aware of that. And we also know when you have a concussion, what's going on, just like anywhere else in the body, when you have an injury, to heal that injury, you need a lot of energy rushing to that site, to that injured site. And we know for kids that rush of energy is a heightened process and a prolonged process, which may account for why recovery times can be longer in kids. So just to put some visuals to it, so this I thought was a funny one. Kids, their emotions are different. They respond to situations differently. They don't regulate their emotions the way we might. So at our offices, we may feel like this sometimes, but we usually don't act like that, at least not all the time and not always. We know they have lots going on, right? They have school, they have chores, they play a lot of sports. They're thinking about the future all the time. Their future is pretty bright and big, where some of us may not have such big goals anymore as adults. They have different coaches in their lives, and some coaches are great and some not so great. I'm not going to go into detail around this gentleman presented here, but I think we have to realize that not everyone has the same supports. And some people's families are just different. Some might be really big and some might be not so big, so we need to be aware of that. And then again, this idea of the environment. So school is not the easiest place to sort of recover from any injury, let alone a brain injury. So we need to be aware of that. And a lot of these kids are, they're on the subways, they're doing lots of things in very busy environments, which is going to make the brain work a little bit harder than it probably needs to. Okay, so let's think a little bit about concussion in sport in general, but also specific to soccer. So we know lots of kids are playing organized sports, and that is a great thing. And from my perspective and our perspective within our concussion center at Holland Bloorview, we want kids playing sports. So I've been playing competitive sports since the age of 5. I think everything I've learned in my life is from sport, and we want to make sure all kids are engaged in sport at the highest level, but just doing so in a safe way. We know that kids playing organized sports are 6 times more likely to experience a concussion than during other leisure activities. We finally have some decent concussion incidence data in Ontario. So this is a study done by a group at York University in Toronto, the north end of Toronto, where, in the past we're always looking at American stats. We really don't have a lot of information on concussion in kids in Canada or across the world, to be honest. There's a lot more to be done. But with this data, we're seeing incidence rates, at least of kids that are showing up to the emergency room. So keep in mind, those numbers are pretty significant, but I would argue that they're much, much higher, probably close to 50% or more higher. If we think about, not everyone goes to the emergency department if they have a concussion. And we know this injury is massively underreported. So those are just kids showing up at emergency. Within our work and our series of research studies over the last 6 to 7 years, we see about a 10 to 15% annual concussion rate in youth athletes. So out of about every 100 kids, we're seeing every season 15 of them are going to go on to have a concussion. And to me, that's a pretty significant number and warrants more focus specific to kids and more education, just like this event that we're doing tonight. So here's a little study that came out in 2012 specific to youth sports, high school sports. And this, again, this bias to a lot of our data is US focused, and we in Canada here, we're getting there. We need to do a bit better job, but I think the momentum is in our favor right now for kid concussion research here in our country. But with this study here, it just showed the concussion rates across different sports in high schools in the US, and this was a really large sample of athletes. And we see girls soccer had the second most number of concussions out of the 19 sports explored. And we look at the rates of concussion, so not just the total number, but the rates. Girls soccer was 5th out of 19 sports explored, so pretty high numbers. And the boys side, we saw, again, some pretty high reporting rates, total numbers, 5th out of the 19 sports. And as far as the rate of concussion, we're looking at 9th out of 19 sports. So it definitely, from this study at least, it's a significant issue in soccer, and we need to start to be more aware of how to manage this injury. Here's another study out of a group here in Toronto, and many of them, some colleagues of mine at the University of Toronto, doing some really great work. And this is around concussions and heading in soccer, which I know is a really big topic, especially in the US. There's a group called the Sports Legacy Institute based in Boston, and they're putting together a pretty massive campaign to get heading out of the youth game. So you may see some information on that if you haven't already. So this study showed that increased concussion rates happen more from player-to-player contact than anything else. It showed that females had a higher rate of concussions, and it also showed that goalkeepers and defenders had a higher rate of concussions. So just to give you a little bit of a sense of some of the research out there, there still needs to be a lot more done, and I'm hoping if you guys are interested, we can engage some of your organizations, but just a bit of a snapshot of some of the work that's been done to date. Okay, so let's dive into a bit of a scenario. So this is Sara. She's a 14-year-old female. She just played a regular season soccer game, so the season's in full swing right now. Headed the ball with contact from an opponent. At the end of the half, she reported a slight headache and being dizzy. So what do we do now? And even thinking about the coach's role, what are we going to do with this child? So some of the basic messaging that I like to give around what do we do if you think you've had a concussion are, again, going back to this simple infographic. You're going to stop. You're going to stop studying, using electronic devices. And in this case, for Sara, we're going to stop playing. we're going to get immediate help, and that means medical attention. And I know it's difficult sometimes to seek out medical attention and put that effort to go to emergency or to get a GP appointment, but for us it's really quite important. One, you want to diagnose that injury. If there has been a concussion, you want to know. And two, I think more importantly, is we want to rule out any other more severe brain injuries. So getting to that emergency department, if nothing else, to rule out a more serious brain bleed or something that's going to cause a more significant injury, a coma, anything like that, we want to make sure we're ruling that out right away. So at least we can treat this injury for what it is, being a concussion and not something else. Then we want to rest. So we want to rest that mind and body, at least initially, to make sure that it has enough energy to heal and all that energy isn't being used up. And then we want to take it slow. So we want to slowly get back to studying, working, and then playing. And in that order, we want to make sure we can handle school and life before we take the pitch again. And I'll touch on a few of these topics around returning to play a little bit later. So when it comes to returning, well, not too much later, right now actually. So when it comes to returning to sport, there's a basic protocol that we all follow. And this protocol was developed at a 2012 meeting in Zurich, Switzerland, which I was thankful to be at, where we developed some international consensus guidelines around concussion and how do we manage it. So with this protocol, and I'm sure many of you have seen it, so it's the general return to play protocol. You have a concussion, the first stage is no activity and complete physical and cognitive rest until those symptoms that you're experiencing have subsided. From there, you get into some light aerobic exercise. If you can handle that, you move on to sport specific, then into non-contact training drills, then full contact practice, and then finally returning to play. So it's quite a process, and there's medical clearance involved there too at the 5th stage before you get into full contact practice. So it's not as simple as feeling well and then jumping right back into things. You really need to make sure your body can handle different levels of activity. So the idea here is it's gradual. You don't want to rush. The way this was developed was more for adult athletes and college-age athletes, and the idea is you need at least 24 hours between each stage. So if you do well at a given stage, no symptoms arise, say during light aerobic exercise, you're supposed to take at least 24 hours before you progress to that next stage. And I argue that in kids, we need to take even longer. So, you know, it's one thing to try something and feel pretty good, and then, you know, sort of quickly go to that next stage the next day, but I would argue you need to try a few times, a few practice sessions at each of the stages just to really have a better understanding of if you're ready to handle the continued load. It's stepwise, so one stage at a time. We're not doing light aerobic exercise and sport-specific exercise in the same training session. We need to really break it up. And it's really dictated by how you're feeling. So this is a limitation in our field right now. A lot of what we're doing, we're relying on that self-report of the athlete, and we all know the motivation of that athlete. You know, I would argue is often well-intentioned, and they are looking out for their brains probably more than we even know. But there are going to be some of those kids that you need to explore a little further if they're telling you the truth. So this is again that idea of giving you some resources. So when it comes to returning to sport, there's some really great tools out there. And one is by some of my colleagues at Montreal Children's Hospital. And what they've done is they've taken that general return to play protocol that I just presented, and they've turned it into a sport-specific tool. So returning to soccer following a concussion, you know, really specific drills at each of the stages that soccer players can do and that will resonate with them. And I think that's a great little tool. And it has a few other sports too. So if you're involved or your kids are involved with other sports, I would encourage you to check out this website and see if you can find some great tools that you might be able to use. As well, the Think First Foundation, now Parachute Canada, has some great educational tools that I always like to direct my clients to and my patients, because you know, there's nothing wrong with having good information at your hands, and I think these are some good tools that I would encourage you all to take a look at. So sport isn't the only thing that can tire out our brains, and we need to be really cognizant of that. Oftentimes athletes have this tunnel vision where, you know, they've had a concussion or really any other injury as well, and they know that they shouldn't play their sport, but they just go on carrying on with everything else in their world. And, you know, maybe for a shoulder or an ankle that might be okay depending on what you're doing, but the brain, you know, is controlling everything we do. And so anything you're doing, whether it's homework, texting, you're on the computer, chores, whatever it may be, that's using energy, that's taking away from healing your injury. and we want to make sure we don't do that. So this idea of a gradual approach to returning to all activities is really key. And this idea that school and life before sport is very, very important. So I always say we shouldn't be putting people in risky situations if they're not able to handle non-risky situations. So if they're getting headaches at school when balls aren't flying at their heads and opponents aren't trying to slide tackle them, then they probably shouldn't be on the pitch doing all those things where they could get hurt again. So some resources for return to daily activities, which I think are really primary and key to recovery. Here's a great tool. There's some great tools from a group at McMaster University at CanChild, and they break down these stages of return to play, but they've turned them into returning to school and returning to daily activities. And they're really great, simple tools. So I would encourage you to check out that website as well. And I do know for anyone in the Hamilton region, there's some great research being conducted by a colleague of mine, Carol DiMatteo, and I would, if you are interested in being engaged in concussion research, please do reach out to her. I know she has a lot of great studies going on right now, and I actually had a meeting with her today and told her about this talk tonight, and she was excited to think that maybe there's some soccer groups around the Hamilton area that would like to be engaged. So you can find her contact information at the same website, at the canchild.ca website. Okay, so if managed properly, in general, that brain does want to heal. As I mentioned, there's a small percentage of people that aren't recovering well if we do the right things after an injury, but it can't heal without rest. And we also know that data is based on adults, so we need to be more conservative in our approach with kids, and we also need to do more research to really figure this thing out in the kid population. So the question I get all the time is, well, why does it take longer for some kids to recover than others? And we don't know the full answer just yet, but we do know that there are a few predictors that are going to dictate longer recovery. One of those is repeated injury. So having a concussion history usually dictates longer recovery time. So that second concussion will probably take longer to recover than the first, and the third will take longer than both of those, and so on. We also know getting back to any activity, cognitive or physical, too early is going to prolong that recovery. We know the severity of the injury, so if there's a prolonged loss of consciousness or some amnesia around that injury, we also see some delayed recovery times. And we also know comorbidities, so anything that's not going to let that brain shut down and really rest, things like depression, ADHD, sleep disorders, can have a real impact on that brain getting enough energy to recover. I always liken it to a staircase when we're thinking about returning to activities. So, like all of us, if you rush up that staircase, which I do often, and you might have that greater chance of tripping, which I also do often, and falling right back down to the bottom and having to start this process all over again. But if you get a good solid footing at each level, at each stage, at each stair, the chances of getting to the top and staying there are much higher. This is an analogy that I'm going to touch on that I like to use with the kids, and I think it resonates both with the kids and the parents. I have colleagues down in Washington, D.C. at the Children's National, and they use a similar analogy about a cell phone battery. But it's the same idea, whatever you think would resonate with your kids and your athletes. And the idea here is that everything we do in our day uses fuel. And when we're concussed, as I mentioned earlier, you need to conserve that fuel in order to allow for proper healing, because you need that energy to heal that brain, and also to avoid feeling worse at the end of the day. So if you're doing too much, I always think when you have a concussion, your tank's at half full, and it's not getting any more full until you recover. So if you're doing too much, you're going to hit empty quite quickly, where you're probably going to get worse headaches and more fatigue. Oftentimes the kids I work with, their worst symptoms are at the end of the day or after doing really taxing activities, and that's because they're just using a lot of gas in that tank. So we need to keep the tank full. So I'll touch on a few things rather quickly here, but just to give you a different sense of, or a different way of looking at recovery from concussion, in case you can apply this to your own worlds. And these are really simple things that I think all of us should probably try to do more of. And I find in my clinical sessions with the kids I work with, the parents are jotting down just as many notes and try to do these things too, because we all want to feel better at the end of the day and have more fuel in our tank. So the first is this idea of energy conservation. So this is a real occupational therapy principle, and it's based on the 4 Ps. First being prioritizing. So you can't do everything in your day because you don't have as much fuel in that tank. So what are you going to do? What are you going to use that limited fuel on? Is it going to be that math test that you have to pass in order to graduate? Or is it going to be, socializing with your friends because you haven't been able to do it? But we just need to be cognizant of that we're spending that energy on the things that are really important that day and not everything. Planning is key, so we need to plan our days so we're not doing too much. We need to plan our weeks so we're cognizant of when we're going to rest. If we have a busy Monday, we need a quieter Tuesday during the recovery process. Pacing is key. We can't do everything all the time, so we need to make sure that we break things up and take breaks and let the brain rest. So we're not reading 5 chapters of that history textbook. We're reading a few pages or a chapter at a time and really letting that brain fuel up again. And this is a big one that often gets overlooked, this idea of positioning. Where are we doing things? So the environment that we do things in has a huge impact on how much gas we use from that tank. You can imagine if you're driving on the busy 401, which I did today and wasn't much fun, and there's cars all over the place. You're using a lot of energy in that brain to try and manage all of that busyness and the noise and all the distractions. Whereas if you're driving on a country road all by yourself, it's a lot easier to do. So we need to be cognizant of that and promote quieter environments for these kids when they're recovering. One thing I see all the time, and I've done this my whole life, where the culture of sport is if you get injured, even if you can't play or practice, you're there to support your team. And sometimes in the early stages of concussion, that can actually be detrimental to recovery because you're in an environment that can be quite noisy and busy. I think sometimes our outdoor sports are a little bit better because there's a bit more space to use, but we want to make sure we're not putting kids in an environment where they're just not able to recover. The next is this idea of sleep, and I won't go into too much detail here, but you can imagine that a good sleep is going to fill our tank up. So we need to promote good sleep routines, regular bedtimes, avoiding technology before bed, which is a really hard sell with kids these days, and even all of us who go to bed with our iPhones and whatever it may be. And this idea of relaxation is a good thing too, to really try to promote those skills. So how do we relax? What are things that we can do to relax? Well, we need to practice it. Deep breathing exercises, visualization, really trying to put that into your day. And I know, I break my own rules here. I tell kids to do this all the time, and I say I'm going to do it too, and it's not easy to build into our day. So we really need to get these kids to keep working on that. Nutrition is a big one as well. So how do we all feel if we don't eat properly or hydrate our bodies? We're going to have headaches. We're going to be fatigued. So if we can avoid situations of fatigue and symptoms getting worse just based on the food we put in our body, then we definitely want to do that. I'll tell you a quick story. I had a client a few years ago who was a high-performing athlete who only ate protein because that's what athletes do. And he quickly realized that when he put carbohydrates into his diet, which is what powers the brain, where protein powers the muscles, he started to feel a whole lot better, and life became a little more manageable. Water, water, and more water. It's huge. We need to hydrate that body. And I always say with the kids, it's a bit of a joke, but it's true as well, that if you hydrate your body, what do you need to do? You need to go to the bathroom often, and that's a great way to pace yourself and to take breaks throughout the day. So a little bit of a 2-for-1 always is a good thing. Again, this idea of school and daily life before sports, being gradual and listening to your body when returning to activities are really key. Again, some resources that you can check out that I mentioned earlier: Return to Play, Montreal Children's Parachute, some really great stuff, and Return to Learn, the CanChild tools are fantastic. So please do jot those websites down and take a look. Another tool that I'm gonna plug here is recently this was a project led by a colleague of mine, a fantastic researcher and clinician, Dr. Roger Zemek, out at the Children's Hospital of Eastern Ontario. And he led a project which I was lucky enough to be a part of, where we have created the first ever pediatric concussion guidelines. And these guidelines have a range of free tools and resources that you can look at. A lot of the tools I mentioned already are included in this guideline. And it also has decision-making trees and algorithms for healthcare providers, for teachers, for coaches. So I would encourage you to take a look at this. The current version is a PDF, searchable PDF document, and we're really working on getting some further research dollars in order to make it a little more accessible to families and coaches and teachers and people to use on a regular basis. But please do check that out. And lastly is this idea of self-management. So, it's one thing to have rehab sessions and for people to come and see me in the hospital, but the system just doesn't allow for a lot of sessions all the time. And we want to make sure that kids and families are developing skills that are going to allow them to take ownership in their rehab. We do that for knee injuries and shoulder injuries and all the other sport injuries, but oftentimes concussion, we sort of leave the families in the dark and rely on healthcare providers to manage it. So using things like activity logs to plan out your day and record how you're responding to different activities can be really useful. Symptom scales to keep track of your symptoms daily or weekly can go a long way. Excuse me. And returning to play activity logs can also go a long way. So if anyone's interested in some of these tools, please reach out and I can provide you with some templates that you can use. So the idea here is if we try to apply some of these strategies and do so at a widespread, broad basis, we can really help these kids feel better at the end of the day. And this is without fancy equipment and expensive protocols and daily rehab. This is just by changing the way we live our lives and make sure we have fuel left in the tank. Okay, so in the last little bit here, I want to touch on this idea of baseline testing. So we hear it all the time across youth sports that that teams are thinking of doing baseline testing or they're already doing it, and I get this question a lot. So I just wanted to give you a sense of what baseline testing is, just so you're a bit more informed when you are getting approached by different groups. So really, when you boil it down, baseline testing is a method used to assess pre-injury performance across any type of test or performance domain in order to compare it to post-injury performance, and in our case, post-concussion performance. The key here, and I know sometimes this testing can be marketed pretty aggressively as sort of you do this, you're going to be okay, but it's really one tool in making informed return to play decisions. So it does give, as a clinician, that selfishly, it gives me some great info to compare to that individual, but I'm still going to be looking at symptoms, I'm still going to be looking at concussion history and all the other things involved in that child's life. So it is one tool in the broader picture. We know that it's important to not return to a sport until performance has returned to pre-injury levels when you have this information. So again, selfishly, it can help provide a more accurate index of readiness to return to sport. And it also is one piece of that puzzle in helping to inform brain recovery. So it gives us a sense of how that brain is responding to the injury. One thing that a colleague of mine, our director in our program, Dr. Michelle Keatley, has always said is this idea of garbage in, garbage out. So, when we are using a baseline test as a comparative after an injury, if that information going into that pre-injury assessment is garbage, meaning it was conducted by folks that weren't trained on the tool and how to use it with anyone, and especially with kids, or if that child wasn't motivated properly or wasn't trying, or they just weren't supervised, and you didn't really get a good sense of what went into that baseline test, the chance of having good information to use it to make good comparisons and good decisions at the end of the day if a concussion happens are pretty slim. So we need to make sure that if baseline testing is happening, that it's being done in the right way, and that these kids are being treated by people who are trained to work with children in a healthcare setting. And the other key, too, is thinking that the baseline test really, when it comes to concussion management, that's the easiest part. You're testing kids that are not injured on tools that have been standardized and that are usually packaged quite nicely. The hard part is after the injury and making sure you use that information appropriately to manage that injury. So you want to always keep in mind who's delivering this baseline test. Are they trained to deal with brain injuries? Have they been trained to work with kids? And are they really going to be able to help me treat a brain injury after the fact? Otherwise, there's no point in doing the baseline test with that individual. So visually, this is one way I like to think about baseline testing is, if we have a young soccer player, for example, and let's look at reaction time here. So on this scale, So the higher the number, the quicker the reaction time, right? So for this young man, before a concussion, his reaction time was really off the charts, really high. So he's responding to visual stimuli, at least on this test, really, really quickly. And that's probably why he's a great athlete and why he's on your team, because he has those skills already. So if this young man has a concussion and his reaction time's impacted and it goes down, you can see from that second blue bar, it's down quite a few points, and it's quite a different reaction time score. But if you don't have that baseline information to compare this individual to himself, and you only go with how the normal population reacts after a concussion, if you compare to that red line, this kid's still doing better than the normal kids, than the normal population, but it's definitely not his normal. So that's the value of a baseline test. We do know that concussion, as I mentioned to you guys earlier, can result in a range of deficits, physical and cognitive. So cognition, balance, strength and agility, different emotions. So if we know all these things can be impacted by concussion, then it would make sense to test for all these as well, so that we can really compare and be confident with our comparisons after an injury. So say you only did a cognitive test, a computerized test that the kids might sit down in front of, and someone has a concussion and you put them back on that test and they do quite well. Well, maybe their cognition wasn't in fact impacted by their concussion, but maybe the other symptoms, they may be experiencing other symptoms like balance issues or emotional issues. And if you don't test for them, then you just don't know. So we may be putting kids back to play without really checking out the full picture. Again, we know the brain is complex, and you really do want someone trained in brain injury to complete and interpret pre- and post-injury testing. So if you are engaged in baseline testing, and there's a lot of great groups out there, just ask the right questions. Make sure they are trained to do this tool and what the training is, and just be confident that you're going to get some great care at the end of the day. One of our research studies that I wanted to touch on that we're just finishing up right now at Holland Bloorview was around this idea of baseline testing. And we used a range of different measures, cognition, balance, strength, but also this idea of using heart rate variability or a physiological parameter to get a sense of, can that help us get an idea if kids are ready to go back to sport. But with that aside, I think what we were really trying to do is to see, out of all these kids, and we tested over 1,000 at this point, is baseline testing really something that's useful? What tests are really reliable with kids? Are they telling us what we think they're telling us? And really trying to boil down, if we are going to do baseline testing with kids, what's the best way to do it? So the data is being crunched on that as we speak, and we're really excited to see what the outcomes are. So in closing here, a few more slides, but this idea of the role of the coach. And I'm sure many of you on the call right now are coaches, or at least you interact with the coaches on a regular basis. So, what I think the coach should be doing is making concussion education available and part of the team orientation and training camp. Really this idea of getting everyone on the same page. And again, I commend the OSA for all their efforts in really trying to get people on the same page. And I think, until we start to do that, it's an uphill battle. The coaches should be aware of the signs and symptoms and be able to recognize them in your athletes, or at least ask questions and monitor them in the right way. They should be aware of return to play protocols and not allow players to return to team training and contact practice without that medical clearance. I think coaches really play a role in creating a safe environment where players can report symptoms to their coaching and training staff. I've played on a lot of teams over the years, and I know a handful of coaches I've had. I don't think they would respond too well with me telling them that I had a headache after a body check or something like that. So we need to make sure we are telling our athletes that they can let us know how they're feeling, so we can help them stay safe. I think as well, coaches can help contribute to their club's concussion policy. Let their club know, what coaches really need and what you as a coach would need to do to make sure you can support your athletes. And one big thing here, as I always say, diagnosing a concussion is definitely not the role of the coach. So this is something that we leave up to the medical professionals, and we want to make sure that we have an action plan in place so that these kids can get evaluated, and it isn't the coach making these decisions on the bench or at a tournament and deciding if kids can keep playing. And I think, as a coach myself, I think that's a bit of a relief, and the parents should realize that too, that it's not, if I'm taking a player out, it's nothing personal. It's that we're trying to protect this child, and that's what the coach is going to do. So I'm not going to go into these, so I'm just going to skip through some of this information, but I do want to let you know that OSA is doing a great job already. There's concussion information on the OSA website, and these events I think are fantastic, and more than a lot of youth sports groups are doing, and I really commend you guys for your efforts. So if you haven't already, I'll put a little plug in there for Matt and for the rest of the OSA group to take a look at that concussion section on the website. A couple other tools I want to pass on to you. Some of my colleagues at the Play Safe initiative at Sunnybrook Hospital, they have a tool that I contributed to the development that just speaks to how to develop a concussion policy and what goes into that, and some of the things you want to think about. So I'd encourage you to take a look at this website and see if there's some resources that resonate for you and for your organization. So with this, it's a free download. There's some really good stuff. Talks about emergency planning, ensuring safe play, building the science, a gamut of info. It's a brief document. It's not meant to be exhaustive, but it is meant to just sort of get you thinking of the things you need. And then, reach out to me or reach out to this group, and we can help you think about it further. They also have a really cool tool that I think some of you may want to take a look at, and it's absolutely free. It's an app where you can track injuries, and also I think another neat part is that it allows you to identify where the closest emergency department is. So if you're playing at a tournament, you pull out that app and it will tell you exactly where to get the care that you need. So check out some of these resources if you do get a chance. And here's the contact information of the Play Safe group if you want to jot that down. Brandy Tannenbaum does a great job keeping kids safe, and I think it might be a group that you want to connect with. When it comes to education, again, here's some more resources, a few that I've already touched on, but there's another one from OPHEA, so the Ontario Physical Health and Education Association. They have some concussion protocols that are more designed around schools. And returning to learn and so on, but also some great resources that you may want to take a look at. And some groups in the States, the Center for Disease Control, the CDC, and the US has some really great tools, absolutely free, that you can download and share with everyone in your organization that I would highly recommend. And again, this idea of the pediatric guidelines, if you do want a sort of a broader look at some of the tools out there, that's a good place to start. There's also some great courses and tools out there that are absolutely free that you can look at. So here's some links: NCCP, Concussion Awareness Tool, which is a really great tool out of BC. And the Parachute Group has some e-learning platforms that do have a cost. If anyone's local to Toronto or close to the Holland Bloorview Hospital, which is Bayview and Eglinton, you can, we have a weekly concussion education and support session you can check out. You can always email me or follow this link that I'm putting up now. And this is just a venue for kids to get some strategies and some support after a concussion, and we welcome anyone to come. We also have some webinar options for that if you're coming from out of town, that we can work with you to access if needed. Another resource that I wanted to throw your way, Dr. Mike Evans, the YouTube guru, colleague of mine, does some really great work on keeping information simple. So he has some great concussion videos, one of which I was lucky enough to collaborate on. So check these out, and they're really great for kids too. They're short, they're interesting, they're whiteboard animations, so something that kids tend to like. And this idea, again, of keeping the messaging simple. We don't want to overwhelm kids, parents, the coaches in our organization, trainers. As soon as you give them too much information, things shut down, and I think you really lose the messaging. So things like these infographics can go a long way at sort of making things simple and accessible. We also try to have some fun with especially the younger kids, brain mazes, this word search where we look at concussion symptoms are embedded in the word search, and who knows, maybe they stick a little longer when you put some fun around it. So what I hope you got out of this session is a better understanding of concussion in soccer, approaches to managing the injury, what the role of the coach in concussion management might be, a whole lot of resources to build your toolbox, and you can always reach out and I can give you more direct links as needed, and of course that idea of a contact if you need it. I'm really big in the idea of collaboration and trying to help as many kids and families as we can, and I'd love to work and talk to each and every one. So here's my team at Holland Bloorview. There's my ugly mug circled in green. But I wanted to thank you all for this opportunity. Thanks, Matt, and thanks, Sharon and the OSA. And please do reach out at all those various contact information or methods of contact that I have listed there, whether it's Twitter, whether it's our YouTube channel that has some really great webinars on there that you may want to check out, and even some of our hashtags. So thanks so much, and hope you guys all have a safe season.
Excellent. Thanks so much, Nick. That's fantastic. A huge amount of information there, which I'm sure people will be able to take away and follow up on. We don't have any questions, but I'd like to sort of close with commenting that from the OSA's perspective, we're required by the Ministry of Tourism, Culture and Sport to have concussion protocols, as they describe them, which would include the return to play or return to sport process. So you referenced those kindly earlier, Nick. They're on our website for clubs and coaches to use. We're also, you mentioned there the NCCP free concussion workshop, and we're actually going to make that mandatory for coaches from 2016 onwards. It's a fantastic tool, very user-friendly, and I took it earlier in the year, and know that coaches will get an awful lot out of that content.
That's fantastic.
Having said all of that, it's one thing to have the concussion website and a page up there, but it's key that we have the right partners that can help us and provide us with the right information at the right time, and we really appreciate the support that yourself and your large team there. I didn't realize there were so many people with you, Nick, but
it's getting bigger every day. Yeah.
Good. Well, I don't know if that's good or that implies there's more demand, but good that we've got the expertise there.
Yeah, oh, definitely, Matt. And, you know, as I mentioned throughout the presentation, and we've had a lot of conversations today, you know, kudos to you guys for all the efforts you're putting into raising awareness within your organization. And as I've always mentioned, we're here to help and happy to collaborate in any way, whether it be research, clinical, or just general education. So thank you very much.
Not at all. Thank you. Very, very much appreciated. So for our listeners and our viewers, this will be, or has been recorded, and we'll be able to make this available on the OSA website probably early next week. So by all means, visit the website. Club/districts is the drop-down menu that it will appear under. And by all means, circulate it. We'll tweet out the link and make sure that as many people as possible are able to view this at a later date, and it's there as a bit of a reference point. With all that being said, we're right on 8 o'clock. There's the strike of the clock. So I'll say thank you very much to Dr. Nick Reed and to our attendees, and we'll see you out on the field soon. Take care.
Thanks so much, everyone. Appreciate it. Good night.
Good night.